Hello and welcome to Health for Naija. My name is Dr. Ngozi O. I'm a physician and health educator. Today I'm going to talk about abdominal aortic aneurysm. What is it? What do you do for it? This is really health education. So what I do here is provide health education to bridge the health knowledge gaps, and it's not medical advice or diagnosis or treatment. It's just a conversation and education. So let's talk about this. What is this? You may have heard of it. Let's talk about it. What is it? So AAA, it stands for abdominal aortic aneurysm. It's an abnormal stretching of the abdominal aorta. So the abdominal aorta is a big vessel that carries blood in the body to all the organs, and this aorta is at the level of the abdomen. So the medical definition here is full thickness stretch of the abdominal aorta, resulting in a diameter of more than 3 centimeters. So stretch where it should not be. So it's abnormal, or exceeding the normal vessel diameter by more than 50%. So if you're wondering what causes this, this is a weakness of the wall of the vessel. And when the wall of the vessel is weak, it stretches. And it's common in older men and smokers. Those are the two big factors for this condition. So what happens over time is that the AAA, it might stretch, like a balloon. It might stretch, and if it ruptures, this is fatal if untreated. So what do we do? How do we find it? So typically, screening is when you look for something. A person doesn't have any symptoms, but you can screen. So an abdominal ultrasound is used for just a one-time screening in people who are between 65 and 75 who have ever smoked. So like I said earlier on, screening is looking for any silent condition. So when you do a screening test, the person does not have symptoms, and we screen for AAA, that is silent, in people who are between 65 and 75 who have ever smoked. So if you've ever smoked, you're between 65 and 75 and you've ever smoked, then you need to make sure that you've had at least one abdominal ultrasound, which is a screening test. So the screening test is looking for conditions that have not yet manifested. So the person doesn't have symptoms. That's what we call screening. So screening, no symptoms. When we do diagnostic tests, that is for people who have signs and symptoms. So if someone has signs and symptoms of AAA, if it's ruptured or if it hasn't ruptured, they could have severe back pain, flank pain. If it's ruptured, they could have collapse, unexplained low blood pressure. There might be pulsatile mass or something pulsating in the abdomen that could suggest a AAA or rupture. Now, if a AAA has ruptured, this is a surgical emergency. The test is a CAT scan to find the aneurysm or a leak. And like I said, the treatment, if it has ruptured, this is an emergency, surgical emergency. Without the treatment, that rupture is fatal. So AAA can be repaired. If it hasn't ruptured, it can also be repaired either by open surgical repair or endovascular repair. So that's all. Today I talked about AAA, which is the abdominal aortic aneurysm, and how to screen for it. And if you've enjoyed listening to this program, please subscribe and share with your friends. And I wish you a wonderful day. This is health education. It is not medical advice. I'm just keeping you in the know, bridging the healthcare knowledge gaps. Take care and bye for now. Don't forget to like and subscribe, and bye for now.